and welcome to Free Rehab webinar sponsored by Premier Medical Company Limited. I'm Dr. Komut Konchalat, your session moderator. Today, we have the privilege of being joined by our special speaker from the US, Professor Dr. Farley Brown. Hello, Dr. Brown, how are you?
I'm good. Thank you so much. Thank you so much.
Professor Brown is a physiotherapist and a doctor of chiropractic, and also a senior consultant of Zimmer MedizineSysteme Corporation. His topic today will be all about high energy induction therapy. And before we start, I would like to remind you all the attendees that we accept the questions both in Thai and English. And you can type in the chat box below in the Zoom. And I'll be collecting the questions, and towards the end of the presentation, I'll be asking Dr. Brown, and Dr. Brown will kindly answer us. Okay, Dr. Brown, shall we begin?
Yes, thank you. Let me pull my presentation up for you guys. Actually, let's share my screen now. We're going to share my screen. And okay. So, thank you for that introduction. And as we get started here, it's always very exciting to talk about a new concept, or even a concept that has had some iteration that we've seen before, but being used in a different way, like electromagnetism. So, although the technology is not brand new, the way it's being used now is new. So I look forward to sharing this with you. And again, please just hold your questions to the end and we'll get to all of them. So from the beginning, does everybody have a good idea what electrotherapy is? I mean, because this is our fundamental, this is our foundation for understanding high energy inductive therapy or any type of electrical therapy. Because by definition, electrical therapy is a delivery of an electrical current to the tissue on the body, either application through electrodes or an applicator, and its purpose is cellular excitation. Anytime we're inducing electricity to the body, we're trying to create cellular excitation, because we know cellular excitation changes membranes permeabilities, allows for ionic flow, metabolic processes to occur, and at the muscular system, it can affect and cause change to skeletal and smooth muscle. What we're talking about today is high energy inductive therapy. We're talking about an electromagnetic field with a very high intensity that we know positively influences human tissue for repair and managing pain. Electromagnetism being our foundation, it's that force between electrically charged particles. Electromagnetism, it's like gravity, but vastly stronger, and therefore the number of macroscopic phenomenon, it's based on all human devices using current in our arena of electrotherapy. Every biochemical reaction in our body is influenced by an electromagnetic force. It's just how we harness it. So if we look at the role in the body, think of the body, whether it's yours or the patient's, as a generator. And this information travels through the body in the form of electrical pulses. Pulses, remember that word. We're talking about, excuse me, pulsed electrical current, pulsed. And every cell has an electric activity. Electricity influences cell generation for healing. It can aid in muscle re-education, and it can duplicate and influence pain to inhibit pain sensations. Electromagnetism, as I was alluding to, has existed. It's existed in our medical arena. Think of an MRI machine, magnetic resonance imaging. With an MRI, we're talking about usage of 1 Tesla. That's our unit of measurement with high energy inductive therapy. We use the Tesla because it's such a prodigious measure of energy. So think of an MRI machine utilizing 1 Tesla. Now we come to our unit, 3 Tesla. If you look at this slide for reference, this is your ordinary electromagnetic device doing pain or tissue regeneration on this patient's elbow. The average milliamperage, 6 to 30 milliamps, give or take. So when we're talking about high energy inductive therapy, to give you an idea, we're talking about having the ability to go up to 3 Tesla, a lot of energy. And again, it's pulsed energy. So the 2 variables we're concerned about with this is current, which is intensity. So increasing the intensity increases the depth of the penetration and the number of neurons depolarized, both superficially and deeper. And intensity, or our Tesla, should be adjusted to produce the desired physiological response. Meaning, if we're looking for pain, we're taking it to a sensory threshold. Or if we're taking it for a muscle re-education or breaking a spasticity, then we're taking it to a contractibility threshold. This is how we're different. So I guess the moral of that story is don't get hung up on the number, but pay attention to what you're trying to achieve. The energy development in high energy inductive therapy is a generator. It's a coil generator that produces pulsed electromagnetic sine waves. And these electromagnetic sine waves, this is where it interacts with the body, depolarizing and causing cell membrane permeability. And again, with that permeability from that coil, frequency and intensity are the variables we can control to get the desired effect. If the polarity of this membrane is low, the cell has too little energy to perform. We're talking about damaged cells here. Disuse atrophy, diseased, something that has a condition that's gone untreated. And we're not getting any type of a response with traditional electrotherapy. Well, now having this much energy at our disposal, cells need energy and we can give it to them. We can cause that cell membrane permeability to have ionization of nutrients, oxygen, and minerals entering the cell, and the excretion of toxins, dioxides, and water. So what this electromagnetic field is doing is increasing energy and optimizing the cells. This is what we're doing with this high energy. Again, with our coil, it has the capability of going to 7 centimeters deep into the tissue. Our primary clinical usages in the physical medicine arena, you could use it for anything. Physical medicine disciplines, rehabilitation, neurological, and our functional orthopedics. But our primary usages, neuromuscular electrical stimulation or muscle re-education, joint mobilizations, and the reductions of muscular spasticity or tone. And not to forget the therapeutic effects on acute and chronic pain. Indications, they're almost the same as with every electrical modality. We can relax muscle spasms, spasticity. We can prevent or retard disuse atrophy. We can increase circulation. We can re-educate muscles. We can maintain or increase ranges of motion. It is a wonderful alternative to pain medication, especially in this area of opioid over translations. And there's a wonderful indication for incontinence or pelvic floor dysfunction. And our general parameters are 0.5 to 2.5 Tesla. And we have a frequency range of 5 to 100 hertz, depending on what we're trying to accomplish. Contraindications, you don't want to run it over a metallic implant. Any history of malignancy, space-occupying lesion. Obviously, if a woman is pregnant, we stay away from the low back and abdomen. And if you don't know what's causing that pain, we don't use high energy inductive therapy. But there again, if we don't know an origin of pain, we wouldn't put electrodes on them either. So we want to know what our cause is. So it's pretty straightforward with contraindications. Clinical conditions, again, you can use this everywhere on the body. Frozen shoulder, cervical pain, carpal tunnel, nerve entrapments in the elbow, rheumatoid arthritis, patellar tendinopathy. Fracture healing, pelvis pain, sciatica, and it works wonderful on spine. So it's got many usages. Now, with the therapy examples, you don't have to worry about skin contact. And where that comes in handy, especially with what we're experiencing in the world with this COVID-19, you do not have to have direct skin surface contact. You can slightly be off, and it can go right over clothing, garments. So you're not going to lose any energy going over a garment. So hygienically, it's a lot better. And with the cultures, there are some cultures that simply going to disrupt for you in the clinic, and that's not a big deal because this can go over clothing, administer the therapy, and have the same desired effect. Examples of our passive pain, again, upper back, shoulder, elbow, knee, ankles, wrists, hip, hamstring. Again, just about any anatomical part you want to work on, you're going to have an application. With our dynamic treatment, we're going to be able to explain that a little better in that there are two applicators that go with this machine, or the little applicator there. There's a bigger one that goes up to 3 Tesla and a smaller one. Now the smaller one comes in very handily as a therapist is doing joint mobilization or manipulation. One hand can be inducing the energy while the other is performing mobilization or a manipulation technique using your hands. So it's wonderful for manual work as well on same body parts. And as mentioned with incontinence, here's a perfect example. Now she does have nothing, she's completely exposed, but if she was draped, that would be fine too. The applicator is slightly off of her lower abdominal pubic region in a supine position, and the therapy has a frequency of 80 hertz. We're dialing in it between 0.5 to 3 Tesla, again, depending on what we're trying to accomplish. Is it a contraction or a sensory stimuli? And the treatment time is 20 to 30 minutes. We would probably elevate the legs there, have them bent at a 90 so she's comfortable and taking the stress off her low back. But there's a perfect example of an incontinence treatment. And if any of you have ever done pelvic floor dysfunctions, it simply was a very arduous task because of electrodes. Now you don't have those. You just have a nice applicator that's going to cause the contraction that we need for strengthening. Couple videos for you. Let's look at a hamstring first. Active hamstring. So using that in conjunction with active passive movement, you could cause almost like an isometric and strengthening that hamstring muscle, but in a very safe, guarded position. Now, let's look at another. Nope, not hamstring, we just did that one. Let's look at shoulder. Here is where we're using the smaller applicator and going through a functional pattern of movement, internal, external rotation. And I have one more for you. Nope, hold on, gentlemen. We have one more. Here we go, knee pain. Excellent on osteoarthritis. So those are just 3 applications, but it gives you a good visual on what else you can do. All right, let me just get our resume share and we'll go into something. Nope, didn't want to do that. Spasticity and tonus, the result of cerebral vascular accident or another neurological condition. Significant and very difficult contractions of extensors in the wrist and in the lower extremity. But with high energy inductive therapy, assisting the therapist in mobilization techniques, they can do significant good and regain some of that lost range of motion. There's a nice paper out on tonus, published in Spinal Cord 2004, done in Munich, but again, it lends credence to using repetitive magnetic stimulation in spastic limbs and lower extremities. So it has a very good usage there. Again, how does it assist with joint mobilization or manipulation? Well, the therapist inducing that functional pattern of movement with his hands is assisted by the high energy, and it is a very significant contraction when it comes about. So these hard repetitive contractions actually help to stress and stretch those fibers surrounding the capsule. And with the repetitive contraction along with the clinician's hand, this is how joint movement is restored. It does the heavy lifting for the clinician. And there's some nice evidence-based literature to read up on that too that we can furnish. But pain. What about pain? We said acute pain, chronic pain. Pain is based effectively on managing acute, subacute, and chronic. Acute pain, a sprain or strain. A subacute pain, a pain of changing nature, maybe a fracture. And when we talk about chronic pain, now we're talking about like an osteoarthritis. So it's based on, the management is based on 3 different theories, really. And we can address each one of those. Low, 2 to 9 hertz, which is more of our endogenous opioid release. This is excellent for our chronic. We have our gait control at 80 to 90. This is more for our sprain strains. And when we talk about our peripheral, this is at 90 to 100 hertz. This is something of like a fracture, where it's going to go through phases of changes, ups and downs. So you can address all 3 of these parameters. And some excellent pain papers that are done internationally. But frequency. We learned a little bit about intensity, but what about frequency? Well, at its best, the frequency of this device, we said 0.5 to 100 hertz. It's how often that wavelength repeats. In the case of electrical current, frequency is the number of times. Our sine wave goes from positive to negative, positive to negative. So the more cycles that occur per second, the higher the frequency. And with higher frequency, there's better penetration of the wave. But there are certain examples to be noted for certain frequencies. When we're talking about muscle re-education, again, slow twitch fibers respond very well to that 2 to 9 hertz. Whereas to get that muscle contraction in muscle re-education, 20 to 30 hertz. And cranking up to 75 to 100, these are our fast twitch, our strength muscles. So you can adjust it at each one of these based on the muscle group you're addressing. And with pain, Again, we just talked about that. Chronic pain, 2 to 9. Acute pain, 60 to 80. And subacute, 100. So you can adjust the frequencies to address whatever pain, where the chronicity of the pain is at that time. And there's plenty of literature to support what we're sharing tonight, I assure you. Now, these devices have come such a long way in that you can use preset protocols or you can adjust them yourself any way you want. So let's go over a little bit of the device and what some of its equipment is. As mentioned, there's 2 channels and 2 applicators. A larger applicator and the smaller one. We saw the smaller one being used primarily in conjunction with mobilization or manipulation techniques, where the larger one was more stationary for heating, active recovery, pain. So again, up to 3 Tesla for the big one, 2.5 in the smaller one, but they both can get up to 100 Hertz. There is a programmable mode with 20 pre-programmed positions. There's a favorite mode that has 20 positions programmable by name. And then there's an expert mode where there's 20 positions programmable by name, where these are ones you can design yourself. Let's take a look at how user-friendly this really is, because you have this guided user interface and it's a touch screen. And we see programs, favorites, and expert mode. You select the channel, 1 or 2, and push start, and you increase. Here's your intensity. You bring it up, and it's preset at 20 minutes. So let's look at that. Let's say the favorite mode. We're taking the favorite mode. There's 20 favorite programs. We're setting the minimum frequency in channel 1. We're setting the minimum frequency in channel 2. And then we're setting an on time, off time. And when we're done, there's what it's going to look like. Ooh, 3 seconds, 10 Hertz on, off. Then for 3 seconds, it's back on, 6 seconds it off, and then it's going to go into 50 Hertz. And this is how you design it. We'll talk more about laying out some of these. Again, the beautiful thing about those pre-programmed positions and laid out, it avoids accommodation. You're having a frequency go from 10 Hertz to 3 Hertz to 6 Hertz, and intensity going from 80% to 95% to 90. It's varying in repetitions and time. This way, the body, the central nervous system, is not accommodating to the current. It's changing. It's constantly changing, which induces a better healing or stretching technique, strengthening as well. The expert mode, again, this allows you to build a program up to 20 steps. Every single step is built the following. You have frequency, frequency, on time, off time, strength, intensity levels, and the number of repetitions. And again, our frequency, our on time, our off time, the strength we want to have, and how many repetitions, and we create a waveform. We create a waveform, and its total time will be calculated automatically. Favorites just allows you to design your own program, step out of the box and try something different. Recommendations, these are based on assumptions, as every patient will be different. Treatment sessions, again, acute pain, 5 sessions. A chronic pain, perhaps 10 sessions. Strengthening could be 10 sessions, relaxation, 5, joint mobilization 5. Again, these are assumptions. Every patient's going to be different, but at least it gets you within a parameter for discussion. And again, individually adjusted to the treating area. Again, if it's pain, we're taking it to a sensitivity threshold. And for other therapeutic effects like muscle reeducation or tone spasticity, we're going to a motor threshold. It's a non-invasive, non-contact treatment. Energy can permeate clothing without loss of energy. And it can be hands-free or unattended. You can put a patient on it and walk away close by and treat another patient. And you can enlarge the treatment possibilities by combining it with other therapies if you want. It's a technology based on high pulsed energy. It's indicated for muscle reeducation, joint mobilizations, manipulations, tonus, and pain effectively. It can be unattended. You can utilize preset protocols or experiment, creating your own. And there's no direct skin or tissue contact necessary without loss of penetration of effect. That's what we're going to stop today for you guys, and we'll open it for some questions. Thank you.
Well, thank you, Dr. Brown. That was very excellent lecture. And we have some few questions here. Let's start with this first one. Can you explain the parameters for treating pain and muscle strengthening? I think you already have explained some details about the frequency. Can you give it a little bit more details about
yeah, you know, maybe what would be helpful, Doctor, is we could go back to the slide, and when we were looking at, like, if we look at examples of pain, we could, maybe this could clear it up a little more. Again, when you're thinking about pain and the frequency for the pain, chronic pain 2 to 9, acute pain 60 to 80, and subacute pain at 100. Now, that's the frequency component. There's still an intensity component.
Yes.
And what we're trying to say then is we're not taking this to a contraction. We're taking this to a twitch, not a contraction. So as we're turning up the intensity, we take it to sensory threshold. That's best. That seems, you know, to work the best for me when I've used it.
Okay,
I mean, I don't try to, yeah, I don't try to overcomplicate it. I think it's pretty straightforward with frequency and intensity.
Okay, yeah, I think I hope this answered the question the attendee asked. Okay, another question. Is it possible to combine this therapy with other PT modalities such as ultrasound, shortwave diathermy, and lasers?
I think you could, but not simultaneously. So shockwave, I would probably do high energy inductive therapy first, and then maybe come with shock. I say that with the effect of this high energy, and then you're coming with, but you know, shock is the same thing. You know what? There's no, so yes, my answer is you can absolutely combine this, but independently. And you wouldn't want to, if you were treating for pain, I think this was the only thing I'd be using. I wouldn't be using this and then putting on another set of electrodes with like a TENS machine or an interferential current. This would be your primary machine for pain management. You know, again, if there's something that requires, you know, more of a regenerative cause, then a shock wave could be used either before or after.
Okay, to summarize that, should not use simultaneously, and for this therapy should be the main thing, right?
Yeah, because I remember when shockwave first came out, and they were saying, "Oh no, only shockwave. You can't do anything else with it." Well, you know, in a couple of years, people started, you know, wow, you know, if I use a laser with it, I'm getting a much better effect, and if even continuous ultrasound had a better effect. And so I never like to take tools away in the toolbox. You know, I mean, if there's something that can benefit by adding it, you know, why not? I think, you know, our hands are our primary tools, but yes, you can combine this effectively with other modalities.
Yeah, absolutely. Yeah, absolutely. And another question from my own, do you think, is there any possibility that this therapy will replace electrical stimulation in the future?
Well, you know, that's an interesting question, because pulsed electromagnetic field therapy has been around for a while. However, they never had the energy output that they have now, like with this machine. I suppose it's really based on, again, for most clinicians, it's going to be based on, number one, what's affordable to them. But as technology advances, certain things do tend to be used less, like ultrasound. You can remember when ultrasound was the standby. It's used very little now because there's things like this that have come around. So you never know. You know, you never know. You know, I remember seeing this machine for the first time a couple of years ago, and I was just like so taken aback with the contraction, the energy that it can induce. So it's definitely a giant step forward, you know, with management of pain and mobilization, manipulations, physical medicine, giant gains in physical medicine.
Yeah, also we have a wide range of clinical application from these tools as well, right?
Absolutely.
Dr. Bird, if you click on Q&A, you will see there's another question.
Okay. I see that. Thank you.
Yeah, you got it. Okay.
There's another question. In acute pain, if let's say it's not improved in 5 sessions, so what is the plan? I mean, like, how we can continue this program?
You know, that's interesting, because with acute pain, if I'm not getting results with this within 3, I'd be really questioning it, because that's how fast results are. So if I was at 5, I would be asking myself some major questions like, how much energy am I using? Where is the location that I'm going on? Because you remember, with pain, our rule is we can go above the area, below the area, or directly on the area. So to get pain, it's pretty hard to miss the location. You know, whereas muscle re-education, we're going to go at an origin and an insertion. So they differ. But I would really, if someone didn't get results in 5 visits for acute pain, I would question the end user. I would not question the machine. I think it's user error.
All right.
I really do.
Yeah, thank you for that comment.
But doctor, to your point, I would you know, definitely experiment and maybe try something else. But first, I would play with parameters and location.
And how frequent is the treatment in terms of the frequency of the treatment?
I mean, 2 treatments, they should notice something. 2 to 3, there should be a significant drop off. Significant drop. I'm not talking total resolution, but like 3 visits. I mean, there's some significant changes that go on when done correctly.
And how far apart is one session to another session?
Yeah, and they do build on one another. They
I
certainly
mean,
do.
How many times per week is the treatment?
I don't think I would go every day, but I think 3 times a week's appropriate. I think 3 times a week's
3
appropriate.
times a week. Okay.
Yeah, I think that's appropriate.
Okay.
Because you're inducing so much energy. Now, you're not going to be inducing any heat, but you're inducing a great amount of energy and give the muscles time to, readapt and revitalize, So I think, 3 times a week's plenty, and then work it down to 2 a week.
Right. Thank you. And we have.
If you look at most of this, yeah.
Okay. What were you saying?
I was going to say, because if you look at most of them, it drops off real quick from 3 times a week to twice a week, very quickly. You might do 3 times a week the first week, and it drops right off to twice a week.
Yeah, that's nice. The patient don't need to come so often. Okay.
No, absolutely. Yeah, absolutely. That's how well it works.
That's really nice. And can this tool be used for a neuropathic condition like diabetic neuropathy? Like, let's say of the beats.
I don't see why not, because you're not generating any heat. What are we worried about with diabetes or any type of sensory deprivation? We're worried about heat and them not being able to give you noxious feedback and burning somebody. There's no heat generated here. It's a stimulation. It's a contraction, so I would use it on diabetes. There's no contraindication for that.
Okay, and another question would be connected to this one. You mentioned that this high induction therapy doesn't produce heat, right? So another question just asked that what's the difference between this machine and microwave and shortwave? Regarding producing heat, okay, we understand, but anything else different between this machine and microwave and shortwave?
Well, microwave, again, outside of heat, you're dealing with a different you're dealing with different frequencies. I think it might be a higher frequency with microwave. So there'll be some variation in frequencies. But
okay, yes.
But again, heat's the big thing.
Okay. The attendees want me to summarize in Thai a little bit. So for the question about the neuropathy, okay, I want to speak in Thai a little bit. สำหรับการรักษาด้วยพวกปัญหาที่ชาปลายประสาทนะครับก็สามารถใช้ได้นะครับProfessor ก็บอกว่าก็ไม่มีเหตุผลอะไรที่จะไม่ใช้นะครับก็สามารถใช้ได้ส่วนในแง่ของไมโครเวฟกับช็อตเวฟเนี่ยก็คือเครื่องนี้มันจะไม่ได้ให้ความร้อนนะครับในการรักษาขณะรักษานะครับเพราะฉะนั้นก็ในแง่ของไมโครเวฟกับช็อตเวฟนี่ก็จะมีความร้อนแล้วก็พูดถึงเรื่องในส่วนeffectiveness ของตรงนี้นิดนึงนะครับ Okay, the next question are there any side effects or unpleasant feeling after the treatment?
I think sometimes you could have some soreness. You could have some usual muscular soreness after treatment of muscle reeducation, but again, that's a normal side effect if it happens. You could have a little soreness in a muscle.
So how many days we expected to be relieved? I mean, how many days usually they have the soreness?
I'm sorry?
How long does the patient usually have the soreness? I mean, like 1 or 2 days and it goes away?
How long would they remain sore?
Yes.
I mean, it's muscular soreness, like a lactic acid buildup. It could be, a day, but nothing debilitating. There might be some soreness. I mean, you were asking if there was any type of side effect. You might expect maybe just a little soreness. That's all. Due to a lactic acid buildup from a contraction or mobilization or something like that. But no, nothing out of the ordinary that would debilitate a patient or
So
leave them in pain.
Okay. So it's relatively safe and we can watch out for the soreness like 2 days or something like that. Okay.
Sure, if it was that.
A little bit. สำหรับอาการปวดside effect หลังจากการทำนะครับก็จะหลังทำพวก muscle education นะฮะก็จะเกิดอาการระบมของกล้ามเนื้อ muscle soreness ได้นะครับก็ประมาณ1-2 วันนะครับแต่ก็ไม่ได้เป็นอะไรที่รุนแรงนะครับ and another questions sorry maybe the attendee wants you to compare the difference between shockwave, laser, and this treatment. that's a question.
The difference between
shockwave
this and laser.
Yes.
Lasers work off of producing ATP, giving the cells energy to heal. So you're not getting an ATP buildup here. You're giving the cell energy and electrical stimulation, but you're not producing ATP as light energy. That's a difference. Shockwave is simply creating new networks of blood supply. Okay, this is not creating new networks of blood supply. It's facilitating what's there and making it vascularized. It's causing that cellular excitation, as we said at the beginning. So those are the big differences.
Okay. Yeah, that's a good point. Let me translate in Thai. Okay.
Sure.
สำหรับเลเซอร์นะครับในกระบวนการรักษาเนี่ยจะให้พลังงานในแง่ของการทำให้เกิด ATP นะครับแล้วก็ดร.เขาพูดถึงว่าถ้าเป็นการรักษาด้วยเครื่องมือนี้มันก็จะกำเนิดพลังงานเหมือนกันนะครับแต่ว่าไม่ได้เป็นรูปแบบที่มาจาก ATP นะครับเป็นการเปลี่ยนแปลงทางถ้าได้ฟังตอนต้นๆนะครับก็เป็นการเปลี่ยนแปลงทางpermeability ของเซลล์ส่วนหนึ่งนะครับแล้วก็เป็นการ charge energy ให้กับเซลล์ของร่างกายนะครับส่วน shock wave เนี่ยจะเน้นเรื่องของการกระตุ้นให้เกิด blood supply ก็คือการไหลเวียนของเลือดโดยเฉพาะพวกเลือดที่ไปเลี้ยงส่วนพวกเอ็นพวกกล้ามเนื้ออะไรพวกนี้นะครับโอเค and yes there another question also the attendee want to know the result between this treatment, shockwave laser, and this treatment, the result of treatment, to compare the result of treatment.
Well, it would really vary with each patient. Each patient would be different. It would depend on the condition too. So you can't lump them together and quantify that. They all have a specific function, as said. Laser, good for circulation, ATP production. Shockwave, reorganizing collagen, creating new networks of blood supply, nitric oxide production. So they all have their place in the hierarchy of treating musculoskeletal conditions. I really can't say one's better than the other because it would depend on what the condition was.
Okay, so it's varies between patient to patient ก็จะแตกต่างกันไปสำหรับผู้ป่วย
It really is. Yeah.
ครับ Okay, thank you for that question and the answer.
You're welcome.
Okay, another question is that from Sandy. Since the patient has strong muscle contraction, will patient have muscle fatigue? That's the question for Sandy, right?
You want to induce muscle fatigue. Absolutely. If someone is in a tonus condition, you want to fatigue that muscle. So that way you can regain some of that lost range of motion. Absolutely.
Yeah, and there's another question. How does the patient feel during treatment? But I guess I can answer that a little bit. Let me just suggest that you
Okay, sure.
on your own first, so you can feel how the patient would feel. How so you know how the patient would feel. You want to add on to that question? How does the patient feel during the treatment?
I mean, I think they feel pretty good. I have not witnessed a negative experience with it. No. And again, it depends on how much intensity you're using. You could make this a very uncomfortable treatment, but that's not the goal. You just want to use enough energy to accomplish what you're trying to accomplish. So no, this isn't like a shock wave.
Sorry, can I add in here?
Okay.
Yeah, I think the therapist needs to evaluate what are the 3 primary parameters that they want to achieve, i.e. maybe they use a visual analog scale to identify pain, or they look at movements of the limbs, or maybe even to the extent that you look at it and sort of say the joint range of motion is affected. And after the treatment, you re-evaluate it. And I think that's the main objective here of therapy. It's not so much about what the patient feels, but what is objective measures. That's my 2 cents.
Yeah. Thank you, Bada, for the comments. Yeah. We do have time for 2 more questions, and the question is, in muscle re-education, does the tool work with neuro patients? I mean, like
Yes.
This hemiparalysis, something like that.
Well, paralysis. I have not used that on a paralyzed patient. The extent of the neurological usage has been tonus and spasticity. So I really can't answer if a patient was, completely, debilitated there. If you could have I can't say with 100% certainty that it would have a healing effect on that, on a paralysis. I can't go off on a limb and say yes.
What about muscle re-education is still useful though, right?
Absolutely. Fantastic for muscle re-education. But something that is paralyzed, that central nervous system now, and, although you can have some good gains with spasticity, if something is paralyzed, something is shut off in that central nervous system. And, I don't think externally we can bring that back.
Okay. Thank you for the question and the answer. So สำหรับ muscle re-education นะครับก็มีประโยชน์มากนะครับแต่ส่วนถ้าเป็นเคสนิวโรที่มีปัญหา paralysis หรือเกตศูนย์เนี่ยก็ด็อกเตอร์เขาก็บอกว่าเขาก็ไม่ได้คิดว่าตัวเนี้ยมันจะไปช่วยทำให้เกิดกระบวนการฟื้นฟูจากเกตศูนย์ขึ้นมานะฮะแต่ว่าใน spasticity เนี่ยก็ภาวะกล้ามเนื้อหดเกร็งเนี่ยก็ยังมีประโยชน์อยู่ครับ Okay, so we have a last question here. Probably the last question. Okay, maybe use this machine with the cancer patient who have pain problem. Maybe sometimes some patient like have cancer for 5 years or so, and they have a history of cancer, and they present with back pain and knee pain or something. So maybe use this machine with the patient with history of cancer, or
it's contraindicated.
it's
contraindicated. Any history of malignancy is a contraindication. And you know why? Because if a patient has been in remission for several years, like you said, 5 years, and then let's say they had a few treatments of high energy inductive therapy, and for some reason that malignancy became active again, the first thing that's going to be asked, have you done anything differently? Oh yeah, I tried this high energy inductive therapy. And in a court, you're going to be guilty of malpractice. And that's global, not the United States, global. So I highly recommend observe the contraindications.
Okay, let me summarize the contraindication again. One is malignancy, and one is the metallic implants, and another one is pregnancy. You don't want to use this around the back or in the abdomen, but if the pregnancy women have like pain in the calf, is that all right?
Yeah, as long as you're avoiding, you're not near the low back or the abdomen, on a woman's okay. If she's pregnant, right.
And another one is pain of unknown origin.
Right. Right. Correct.
This is all the questions we have, and it's quite wonderful to have you here. And yeah,
thank you.
To lecture us and answer all these questions. And do you have is there any possible way or any way that we can connect to you later on if the attendees have any more questions regarding this?
Absolutely. My email, Sandeep has my email, or you can just get me at farley.brown@gmail.com. That's my own personal one, and I have no objections to answering an email. And especially with the COVID, we're not traveling, so I'm my computer's open every day, so I have no objection of being further assistance.
Yeah, Dr. Bala, can you put on the Dr.
Sure.
Farley Brown the email, please?
Yeah, just 1 second.
Yes, and I think that we now come to the end of the session. So Sandeep and Bala, would you like to mention anything about this webinar? So actually I have Kun Oi sitting beside me, the staff from Premier Medical Company, Kun Oi. So if you have any questions later on, you can also call to Kun Oi.
I have typed in chat session, I have typed Dr. Farley Brown's email, but we will be communicating with all our participants later and send them more information. If they have questions, please send us. Everybody has received my email. We'll be more than happy to reply if they have any other questions on this modality or technique.
The audience may want to visit Google Classroom because I've actually loaded up all the articles that Dr. Brown had mentioned, and hopefully they will add on new articles. Google Classroom is a sharing platform, so it's probably a good idea to look at it. So the screen, I've actually sent this along the way. And also the fact is that you may want to do a little mini quiz to check your understanding of the presentation. So you can join the quiz.com by putting in the codes and try it out. It's only 4 simple questions. Finally, our next seminar will be in September. It's 23rd of September, 12 noon again. And we are going to talk about Symphony. Symphony is a novel, wearable technology which is training both the brain and the muscles. Muscles and the brain together as one system. It's very novel, and I think the audience may like to share it with their neuro team as well as the rehab physicians to come in and have a look at this session. We will send out invites along the way. Thank you very much, audience.
Thank you, panelists. และขอบคุณครับสำหรับทุกท่านนะครับที่เข้าร่วมชมเข้ามาในเว็บนาในครั้งนี้นะครับแล้วก็ขอบคุณดร. Farley Brown, Dr. Bala แล้วก็คุณ Sandy. Thank you, Dr. Farley Brown, for joining us, and สวัสดีครับ and I hope you are safe and